This nighttime cold flu relief capsule is used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. It contains dextromethorphan, a cough suppressant, acetaminophen, a pain reliever and fever reducer, and antihistamines to help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. This medication is not usually used for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by your doctor. It's important to carefully follow all dosage directions to decrease the risk for serious side effects and not to use this product to make a child sleepy. It's also important to not give other cough and cold medication that might contain the same or similar ingredients without consulting a doctor or pharmacist. Remember to always read and follow the directions on the package label. Do not give medicines labeled for adults to children. If you have any questions, consult your pharmacist. You can take this medication by mouth with or without food, usually every 4 to 6 hours, as needed, or as directed by your doctor. If your stomach gets upset, try taking this medication with food or milk. Make sure to drink plenty of fluids unless directed otherwise by your doctor, as this will help loosen the mucus in your lungs. If you are using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device or spoon. Do not use a household spoon as you may not get the correct dose. If your liquid form is a suspension, remember to shake the bottle well before each dose. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. Do not increase your dose, take it more often, or use it for a longer time than directed. Misuse of this medication may result in serious harm. If your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, rash, or fever, be sure to consult your doctor as these may be symptoms of a serious medical problem. Some common side effects of this medication include drowsiness, dizziness, upset stomach, and dry mouth. If these effects persist or worsen, consult your doctor or pharmacist. Your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects such as mental/mood changes, trouble urinating, or fast/irregular heartbeat, notify your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help if you experience symptoms such as rash, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. The optimal timing to take this medication will depend on your specific symptoms and should be discussed with your doctor. Be sure to follow the recommended daily dosage as directed by your doctor. Now let's talk about the uses of nighttime cold flu relief capsule. One of the main ingredients in this product is acetaminophen. It's important to be cautious with the amount of acetaminophen you take, as taking too much can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. It's important to consult your doctor or pharmacist to find out how much acetaminophen is safe to take. It's also important to note that you should not use this product with any other drug containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medications, so it's crucial to check the labels on all your medicines to see if they contain acetaminophen. If you're unsure, ask your pharmacist for guidance. If you accidentally take too much acetaminophen, it's important to seek medical help right away, even if you feel well. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Lastly, it's important to be cautious about daily alcohol use, especially when combined with acetaminophen, as it may damage your liver. Always consult a doctor or pharmacist if you have any concerns or questions about taking this medication. Before taking this product, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. If you have certain health problems such as breathing issues, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems, it's important to consult your doctor or pharmacist before using this medication. This drug may make you feel dizzy, drowsy, or cause blurred vision. It's important to avoid alcohol, marijuana, or using machinery until you can do so safely. Some brands of this product may contain sugar, alcohol, or aspartame, so if you have certain conditions such as diabetes, alcohol dependence, liver disease, or phenylketonuria, it's best to ask your doctor or pharmacist about using this product safely. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are currently using. Children and older adults may be more sensitive to the side effects of this drug, so it's important to be aware of potential effects such as dizziness, drowsiness, and confusion. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication may pass into breast milk and could have undesirable effects on a nursing infant, so it's best to consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that may occur when taking nighttime cold flu relief capsule. This includes interactions with antihistamines, MAO inhibitors, and other products that may cause drowsiness. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This medication may also interfere with certain lab tests, so be sure to inform lab personnel and all your doctors if you use this drug. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Additionally, be cautious of other products that may contain the same or similar ingredients, as using them along with this medication could increase side effects. If someone has taken too much of this medication and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes and skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Remember to keep this medication out of the reach of children to prevent accidental overdose. Make sure to keep all your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of your health and follow up with your doctor as needed. If you are taking this medication regularly and you happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, then just skip the missed one and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. As for the optimal timing to take this medication, it is best to take it at night time for relief from cold and flu symptoms while you sleep. The recommended daily dosage should be followed as directed by your healthcare provider. Remember to store your nighttime cold flu relief capsules at room temperature, away from light and moisture. It's best not to keep them in the bathroom or freeze the liquid forms of the medication. Always keep all medications out of reach of children and pets. When it's expired or you no longer need it, make sure to properly discard the product. It's best to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.